You know, Kelly, I'm used to having a couple hundred people in the audience.
You're an easy target. Everybody believes it with you. They think Dr. Roberts is too nice to be That's not what your sister tells me.
That's what Angela calls it. She calls me the good sister.
And you riding it out, aren't you?
Of course.
How are your parents?
They're good. My mom's doing well.
Okay.
We took her out for a drive Saturday for the first time.
30 seconds. Let's roll the open.
Good afternoon and welcome to the Columbus Metropolitan Club. We're streaming live from the Boathouse at Confluence Park. I'm Jane Scott, and it's a privilege to be the CEO and president of the Columbus Metropolitan Club and to welcome you to our broadcast. And happy Earth Day. Today is the 50th anniversary of Earth Day. We're used to hosting a couple hundred people in this room every Wednesday for our CMC forums, so we miss you terribly. But we're very grateful to have the technology of live streaming to be able to bring our forums to you instead of you coming to us right now. We have a lot of new viewers, a lot of new friends we're making, and you may not know that the Columbus Metropolitan Club was founded by 13 women leaders in 1976 when they weren't necessarily welcomed into the men's clubs. So they decided to start their own organization, and they called it the Columbus Metropolitan Club. And now, not out of any malice or ill will, but they wanted access and they wanted to provide the community with conversation. They opened their organization from the very beginning to everyone. They wanted their organization to be inclusive, which it is. And today, the Columbus Metropolitan Club, a 501c3 nonprofit organization, has more than 1,400 members that support our programming through membership dues, annual membership dues, and more than 100 companies and organizations that support our mission through their sponsorships. We rely on these sponsors and partners and members to support the mission, and we look forward to meeting many of you as possible new members. Today's forum is supported by National Church Residences, the African American Leadership Academy, the Community Shelter Board, and Ohio Capital Corporation for Housing. And our live stream partners for the special report series are NBC4 and NBC4i, WOSU Public Media, PNC, the Tom E. Daly Foundation, MORPC, the Dispatch Media Group, and the Ohio State University Wexner Medical Center. We also want to thank many of you who supported CMC through your continued membership, but most of all, for those of you who stepped up to buy a virtual seat for this forum. These dollars are really critical for the Metropolitan Club right now, and we really, really appreciate it. You can still donate today, right now, during the forum at columbusmetroclub.org. An editorial in Sunday's Dispatch reads, "A simple fact is becoming heartbreakingly clear. The many hardships now traceable back to the virus that were virtually unheard of just a few months ago are being felt much more acutely by those who were already on society's margins." As we learn more about this disease daily, let's hope that we are also gaining new appreciation for how fragile life is for people who just get by during the good times. Sadly, this is a fitting preamble for today's discussion, so let's get started. With nearly 2 decades of experience, Mysheika Roberts leads a team of 500 professionals as Commissioner of the Columbus Public Health. Welcome, Dr. Roberts.
Thank you.
Taking the helm of the Columbus Urban League in 2011, Stephanie Hightower serves as the 8th president and the first female to lead the organization. Welcome, Stephanie.
Thank you for having me.
And our host, Emmy Award-winning journalist, host of NBC4 The Spectrum, an attorney and a CMC board member, Colleen Marshall. Colleen, we're looking forward to the discussion. Thank you all.
I am looking forward to it, too. I know you each have interesting perspective, but I want to start with just an overview. I'm going to ask each of you, Dr. Roberts, for where we are medically, and I want Stephanie then to weigh in on where we are as a community as we go through this now nearly 2-month shutdown of our economy, our system, our families, our lives. First, Dr. Roberts, talking about a May 1st reopening, where are we medically in this crisis?
So thank you, Colleen, and thanks again for having me here today. I'm happy to talk about not only what we're seeing here locally with COVID-19, but also to talk about some of the special issues that have come to our attention during this time. So currently, we have over 1,600 cases of COVID-19 right here in Franklin County. If you compare that to the state, there's about almost 14,000 cases across the state. We continue to get new cases every day, and what's most concerning is we continue to have individuals who lose their life as a result of COVID-19. Here in Franklin County, we've had 37 deaths that have been related to COVID-19, and we've had almost 300 individuals that have required hospitalization. So we are still battling this pandemic here locally. We still see cases not only here in Franklin County, but across the state every single day. In terms of the May 1st reopening, I am optimistic, as I've been from the beginning of this pandemic, that we're going to continue to see very strong leadership from Governor DeWine as well as Dr. Acton at Ohio Department of Health that will guide us out of this pandemic following the data and following the science, just like they guided us into this pandemic. So on May 1st, we will wait and see exactly what the state decides will open. It will not be an open door for all businesses, I can assure you of that. And there are going to be things that we all have to take into account. And I think Dr. Acton has made this very clear, that life as we knew it in January and February or even a year ago will be very different come May 1st, come June 1st, and come July 1st. And so we all have to prepare for that difference. It's going to take us some time to get a vaccine, to get appropriate treatment, and get the testing that we need in place to appropriately tackle this pandemic. And while we wait on that time, we're going to continue to see cases, and unfortunately, we're going to continue to see deaths. But there are things we can do as individuals to help protect ourselves and help protect our families, and I just want to remind you of what those things are. First of all, you need to wash your hands all the time. We were talking about how dry our hands have been because we're washing them so much. So it's very important that you wash your hands all the time. If you do have to go out, again, only for those essential tasks, you should be wearing a mask. That is the recommendation by the CDC, and Dr. Acton has encouraged all Ohioans to do that. And then you should stay within your own household contacts. And so you shouldn't be having neighbors over, you shouldn't be having extended family over to your home. Just those individuals who reside in your household should be the people that you're interacting with in that close contact. So I would encourage people to practice those guidelines, as well as if you are sick, notify your healthcare provider, contact a healthcare provider, and see what you need to do to be evaluated for whatever symptoms you are exhibiting. So again, wash your hands. If you do have to go out for those essential duties, make sure you wear a mask. Just stay with your immediate family or your household contacts, and if you are sick, contact a healthcare provider.
Well, Ms. Hightower, or Stephanie, if I may call you
Please.
Stephanie. Stephanie, I know you are in contact with the community and hearing from people who are now living the life that Dr. Roberts has described. What are you hearing about where we stand as a community economically and health-wise?
Thank you again, and thank you, Colleen, for that question. Thank you to CMC for hosting this forum. This is a very, very important topic. You're always on the forefront of those topics that our community needs to hear about. And really thank you to everyone for their encouragement, the collaboration, and the support that an organization like the Columbus Urban League has been able to receive over the past 4 weeks. So, I think it's really important as we're here to talk about the disparities as it relates to communities of color I really wanted to start off with this quote today because I think it's important for us to understand what we're talking about here. And that quote is, "We're in the storm, but we're not in the same boat." And so when we start talking about communities of color, we know, being an urban economic first responder, that we've had to put a lot of high priorities, Colleen, on housing, financial management, and small business creation and revitalization and job placement. And so because of this pandemic, we know that problems are about to get exponentially worse for communities of color. We need to begin to look at how do we build capacity with culturally competent and trusted providers and human services agencies. I just had a call the other day from one of the leaders in the Somali community who basically is saying that, you know, their economy has been decimated because most of the women in particular who are heads of households, they run daycares. And so now those daycares are closed, so there's no income. I had a young boy yesterday meet me and my VP at the front door of the Urban League who had a note that Melinda finally took it and said, basically it was a note from his mother. He had to be 14 or 15 years old, Somali young man, and the note said, you know, we need $200 so that we can stay in our home right now. We have to make sure that, you know, we're looking at, and we need to have bridge builders with the police as well as in the black community. There's already racial profiling that's starting to happen across the country. I talked to Chief Quinlan yesterday. We haven't had any incidences here, but when you start talking about black men wearing masks, that is a problem. And so when you look at it, and I know Dr. Roberts can expound upon this, those that are contracting COVID are between 20 and 29 years of age, and you start talking about young black men who are already worried about racial profiling. They are not going to put a mask on their faces to be safe. Housing insecurity is another big issue that we are paying attention to. I hope the community realizes that while we are putting and sinking a lot of money into the Community Shelter Board and to make sure that people are not being homeless, we still need to know that eviction prevention is needed. Right now, there are over 1,000 families that are in the queue right now waiting for June 1st, the courts to open so that they can start eviction proceedings. And I think I got some information from my colleague, Bo Chilton, who was saying that probably by the end of June, there will be 3,000 people in the queue. So we're looking at the possibility of our shelter system being flooded right now. And those people are disproportionately people of color. One of the things that we've been trying to do is to create messaging for the communities of color. And so we launched a macro communications effort, teamed up with City Council and Radio 1. So once a week, we do a live broadcast on 3 stations, and it's been very effective because what people need to understand is that communities of color don't necessarily trust conventional media and what's out there, and so they need to hear from those trusted individuals who basically have culturally competent messages that they can actually relate to. We've also developed a collaborative for information and advocacy work with over 100 African American leaders from the nonprofit, government sector, civic sector, the NAACP, because we need to make sure that we're consuming information as well as then getting it out. And then we also know that small businesses are the backbone of the African American community as well as the other communities of color, Colleen. And so how do we make sure that these small businesses now are going to be equipped so that they can go after those loans? We know there's another wave coming down. Just got a text from Congresswoman Beatty, who was on an empty plane going back up to D.C. Bless her heart, and thank you for her service. But, you know, they're going to be voting on that next wave. So within the next 24 hours, we've got to try to get minority businesses that technical assistance so that they can apply, and hopefully they will receive the second round of funding.
It had to infuriate you when the news came out of publicly traded companies that have thousands of employees, like Ruth's Chris Steakhouse, home of the $60 steak, that got millions of dollars in small business loans when the fund was tapped out so quickly. And I imagine there is a problem for truly small businesses of 1 or 2 or 5 employees. This goes up to 500 workers, that even the lenders, the banks that are managing these funds, are much more concerned about taking care of their client that has 400 employees than moving someone with 5 employees to the front of the application process. How are you maneuvering through the system or helping people maneuver through that system?
You know, I have to say, you know, and I'll even go one step further. You know, this morning when you see that, you know, Harvard, who has what, like a $30 or $40 billion endowment, was also, you know, an institution who received that money. It was actually heartbreaking to know that these large conglomerates were actually going after the small business, payroll protection. I will say this. I did have a conversation yesterday with my board chair, Todd Williams, as well as Sue Zazan from Huntington Bank. And, you know, I have to say that institution is making a concerted effort to make sure that they're not bumping people up, that whoever came into the queue, they have a system of who came into the pipeline so that they're not bumping folks up who, you know, you think a big conglomerate can come in ahead of that. So kudos, you know, to that institution for making sure that happens. We're working with some of our larger institutions now, as well as we're hoping to work with some of the smaller financial institutions, those local banks, so that we can then get those people ready. And it's really about the technical assistance. They may not have a banker. Their credit may be not where they think it should be. So we have a group, we just started, we launched it yesterday, a resiliency fund that the county very graciously funded for us so that we can start putting those people, putting those packages together.
How do they get in touch with you for that?
They can call Melinda Carter, and I knew you were going to ask me for that number, and I'm going to have it before we leave.
Okay.
But you can call the Urban League offices. You can call Avery Frost is our new program manager, because we need to get those people in the queue as soon as possible.
If I could ask you, Dr. Roberts, about the racial disparity that Stephanie touched on. The mayor tells me that he had already assigned you the task of taking a look at health care from a racial perspective, because there is a disparity and there are different health issues that emerge for people based on their ethnic background as well as cultural reasons. So how has this changed or maybe sped up that process?
So absolutely, the mayor did charge my department at his State of the City to look at racism as a public health crisis. And I was happy to take that on. There's been a lot of traction around that issue nationally in the public health arena for a few years now. So I was pleased that he had asked us to take it on and that he, as the leader of our city, wanted us to address racism. I think what I tell people all the time is there was racism and there were health disparities before COVID-19. COVID-19 has just allowed us, or not allowed us, has just put a spotlight on those disparities that existed for many years, if not decades. And, you know, as the mayor puts it so well, he says, you know, I'm going to talk about racism. We don't have to own racism and the history behind it, because we can't. We can't own redlining and all the discrimination that happened before, but we can name it and call it out for what it is today, and then work on addressing it to prevent the disparities moving forward. And so the new Center for Public Health Innovation, which we launched on April 10th, will do just that. It will look at the health disparities that we've been aware of for so long, and it will provide some recommendations. They could be policies, they could be interventions that we as a community can do to help reduce those disparities. And so, you know, just to put it in context, African Americans, we know, have an increased likelihood of being diagnosed with diseases like diabetes, hypertension, lung disease, heart disease. And we've known from the very beginning, the CDC and others who experienced this pandemic before us told us that individuals who have these chronic health conditions fare worse with this disease than others. So that means they have more complications, they need to be hospitalized, and unfortunately they could die as a result of those health issues that they dealt with before the pandemic. And so we're seeing that right here in Columbus. We know that in Columbus, African Americans represent about 29% of our population. But when we look at our COVID-19 cases, they represent anywhere between 29 to 30% of our COVID-19 cases, but they're disproportionately hospitalized from COVID-19. So that means they are dealing with these chronic health conditions that require them to be hospitalized if they do get infected with COVID-19. But we also know that African Americans are more likely to be the frontline workers. They're less likely to hold a corporate job where they can telecommute. There is no such thing as telecommuting if you're a grocery clerk, if you're a fast food employee, or if you work in the transit industry, a bus driver or Uber driver or working on the metro, wherever you might live. And so it's very hard for them to practice social distancing from their coworkers as well as from customers if they're in those type of environments. So that puts them at increased risk for this disease. And then when we talk about their living environment, you know, I love the quote that Stephanie shared about we're all in this storm together, but we're not in the same boat. So we're asking individuals to stay at home. So, you know, for many of us, we probably have, 500 square feet or more per person in our household. You know, I have one family that we've been working with that have 15 individuals living in one household. And of those 15, more than half of them have been infected with COVID-19. And so how can they practice appropriate social distancing, quarantine, and isolation if they're all living under the same roof? And I don't know what their house looks like, but I guarantee you it's not a 3,000 square foot home. So we're not all in the same boat. We're all in the same storm, but we're not all in the same boat.
You know, I know you are part of a program to begin doing contact tracing, which is the state's advocacy. The state is behind this program. You are part of it. So maybe you can explain to us, how do you contact trace for people who still do have to go out in the workforce? What does this involve, and how are you going to train the people who will be doing this? Are you looking for volunteers?
So great question, and thanks, Colleen, for that. So I just want to be clear, we are doing that now. That is the expectation for every case we get, for every confirmed or probable COVID-19 case. I have staff members who interview those individuals. Those interviews take anywhere from an hour to 2 hours to conduct that interview. It's asking the case, when did you first start having symptoms? What were your symptoms like? What are your past medical history? Where do you live? Where do you work? Who do you live with? And from 48 hours before you started having symptoms until you got diagnosed, who did you expose yourself to, whether it be at work or at home? Where did you go? And then based on that information, we ask the case, who did you expose? Give us the names and contact information of those that you exposed. For most people, their exposures are at work because they're working in an essential job, or they're at home. And then we take those names and numbers and we give it to another group who then calls those individuals. And for every case, we have anywhere between 4 to 6 contacts on average. So then we call those contacts and we say, hi, my name is whatever, I'm calling from the health department. We got your name and number because you've been exposed to a confirmed case of COVID-19. We believe your exposure happened on this date. As a result of that, we need you to quarantine, which means don't leave your house, don't go to work, don't do those essential functions. If you do live with others in your home, try to separate yourself from those individuals in your home for the next 14 days or less, depending on when their last exposure was to the case. So we are doing that now, and that takes time. You know, that contact call usually takes anywhere from 30 to 45 minutes. And so we have staff. I'm fortunate that I have a robust staff and, right now, knock on wood, a healthy staff that are able to do that. So at this point, we are not taking volunteers, but that's not to say there won't be a time when we will need volunteers or other additional staff to assist us with that.
When you call someone and say to them, you've been exposed, do they automatically say, well, who was I exposed to? Are you now not revealing private health information?
Correct. So Most of the time, the case gives their family or their coworkers a heads up that someone might be calling you, or, hey, I've been diagnosed with COVID-19. But there are times, definitely there are times when the contact says, who was I exposed to? And because of HIPAA, we can't share that information with them. So those make that conversation a little tough, and you can imagine the person that we're calling is asking us lots of questions. Where was I exposed? When could I have been exposed? What was the exposure like? But again, the majority of the time, the case is letting people know who they were exposed to. And because of our stay-at-home orders and the social distancing we're practicing, you know, most people kind of know who they could have been exposed to because their socialization is limited.
Isn't the state, though, looking for volunteers?
They are, because there are many health districts across the state that don't have the robust staff that I have and need assistance with doing that. But because we know that this is going to continue, we're going to continue to see more cases throughout the summer and going into the fall, and we need to make sure that we can continue those contact investigations as well as the case investigations.
Stephanie, I imagine that there is a psychological factor to all of this, too. People are afraid. Are you hearing from people who are saying, I'm afraid to leave my house, I might have come in contact, I got a call, but I have to go to work, I have to feed my family, I'm an essential worker? It's a scary time.
It is, but then at the same time, as I said, when you look at communities of color, that conventional information that's coming to them, it's, do I really have to stay at home? And especially with our young people. You know, when this first started, the basketball courts were full. You know, those first, I mean, people, you were out playing basketball, you know, until finally the city had to take, you know, go to those recreation centers in outdoor facilities and take the hoops down. It is a constant message. You know, we are, you know, spiritual people, not that everybody's not in all communities, but, you know, the faith-based community right now, being able to tell, you know, my 82-year-old mother and 85-year-old father, which the church is their life and where they get their spiritual uplifting, that they can't go to church on Sunday, that's a really hard piece. And so when you have your seasoned citizens and elderly population who may not have the ability to go online and to be able to listen to a streaming a service on Sunday, that's really hard for people. You have to look at the fact that we have a lot of young people whose parents may be those essential workers that Dr. Roberts talked about, all right, because they are mostly from the communities of color, and they're leaving children at home by themselves. And so what are those children at home by themselves doing? They're going out. They're going to their friends' homes. Or as, you know, Dr. Roberts said, you know, I don't have a 3,000 square foot house. I don't have a 5,000 square foot house. Or I don't have even a 2,500 square foot house. So for me, being outdoors is probably a better place for me to be and to try to social distance than being inside where I am at. So yes, there are people who are, I think, in our community that are paying attention, but at the same time, you know, you can go to certain establishments in the urban core, and you wouldn't think that there is a pandemic going on at all. And that's what I think is the more frightening part, is that people are not. And you have to look at it from a cost perspective. You know, I can arm my folks, my staff people, with a face mask. But most people don't have the income stream to be able to, and, you know, again, you go back to the putting a homemade mask on their faces, then that poses a whole nother group of issues.
You know, both of you know, that the Columbus police have gone to the campus area to break up young people, that they've gone to playgrounds to break up young people, and yet on the state steps of the State House, we have adults, including a woman who was running for state senate, who not only are defying your order and defying the order of Dr. Acton, but going online to brag about it. They've got Nazi flags, they've got Confederate flags, they've got anti-Semitic messaging. Why aren't the police carrying out that order on the steps of the State House when they are taking down basketball hoops and they are going to off-campus parties to break those up? Is your order not being enforced by the city police?
That's a great question, and you kind of caught me off guard there. I think we have to remember that people do have the freedom of speech, and I've heard the governor mention that as well. And so I think it's that balance of trying to, really figure out how you're going to allow people to have the freedom of speech, but at the same time encourage social distancing. I will tell you that in terms of what we've seen on campus and other places, what the police have done thus far has provided warnings. They have not ticketed anyone or charged anyone for that type of behavior. We're trying to do education, and we're really focusing on that to give people education and warning about those practices.
But I don't believe the police were warning the protesters last weekend. And Stephanie, I'll ask you, if these were demonstrators from Black Lives Matter with assault weapons and defying a health order, would they be treated the same way?
Unfortunately, I would have to say, I would have to agree with you. No, they would not have been. And, this is a very complicated time for, our society. Again, I did have a very candid conversation with Chief Quinlan yesterday, and I think we also have to look at it from the standpoint of, and here's part of where we're at. One of the issues we're concerned about right now, Colleen, is the fact that we have overpopulation in the jails right now and even in the penitentiaries. And we know that there are, because they are confined, then there is a greater risk of them being in the jails of catching COVID-19. So it's not a matter of you don't want to put them in jail, because now you're risking, even though those protesters, that was a little bit different, they were already at risk. But now how do you take somebody from the steps who may be COVID-19, have COVID-19, and then quarantine them in a jail cell with people that maybe don't have it? So it's a double-edged sword here. Would the tactics have been different probably in the urban community? Yes, because we do say that in the urban communities, folks come in and police, but in the suburban communities or in the majority communities, they're doing public safety. So there is a different definition when it comes to people of color. I just think, then the other part of this is, we need to make sure that our law enforcement people stay healthy as well. When you look in New York City, the number of, EMS and folks in police who are also, catching the virus. So it's a real double-edged sword here. Do I go into a group of protesters if I don't have the proper, PPE gear in order to, to break it up? Do I want to arrest a bunch of people? No. We know that they are emptying out the jails here, in Franklin County. But that also is creating a problem, because now I have ex-offenders who are getting out of jail with only a prison or a ID, and so they cannot get a regular ID. The BMV is closed. They can't get housing. They can't get other necessities that they need. It's just exacerbated, Colleen. So, this is not a time for any of us to point fingers, I don't think. I think everyone is doing what they possibly could do in light of this circumstance.
You mentioned the testing and what's going on in the prisons. One of the things that Dr. Acton talked about is we need to have broader testing. We don't really know how many of us might have had a slight case and now have the antibodies. And without testing, we won't know. There's still that debate. Who's responsible for the tests? The federal government or the states? Should we be handling this? Should they be coordinating so the states aren't competing to each other? I believe Governor Cuomo called it's like being on eBay, trying to get PPEs, testing equipment, reagents. What would you like to see happen? Are we moving forward with testing?
So I think we are starting to move forward with testing, and if you heard Governor DeWine mention yesterday, the FDA approved a new company to provide reagent, which will be helpful for us here locally to do more testing. We definitely need more testing, and we need testing to be easily accessible to our community. And I have to commend the 4 hospital systems we have here. They've done a great job of testing the community outside of the ER setting. But I will also say that no fault of theirs, but are individuals who don't have a primary care provider or who are uninsured, and we know that African Americans are more likely to be uninsured in our community than our Caucasian counterparts, they might struggle to get a test. And so we've got to figure out a way, and that is something I've been working on heavily this week, to make testing more accessible in the community for individuals who might not be connected to care, but who have symptoms that are suggestive of COVID-19, so they can get tested. But a lot of that depends on, our capacity, and with this new reagent and the expansion of reagent, that will help, because our hospitals were limited by the reagent and the supplies they needed for testing.
I do want to let the audience know, we're taking audience questions right now that we're going to be getting in just a few minutes. We got some ahead of time, so I'm just randomly going to pick a question and see what someone wanted to know. This comes from a man by the name of Kwesi. African Americans are more susceptible by getting COVID-19 because we have more chronic health conditions. We also know that these chronic conditions are a result of lifestyle choices, primarily what we choose to eat or not eat. What is going to be different about how community leaders stress the importance of healthy eating in our Black community?
So I appreciate that question, and I guess I would just pause and say, yes, we all make choices of what we choose to eat and what we put in our bodies, but for many in our minority communities, in our inner city communities, what they're putting in their bodies is what they have easy access to. So if you look at many of our minority or African American communities, whether it be Linden, whether it be the Near East, you have more access to a fast food establishment than you have a full service grocery store. So could you go get vegetables and, saute them and eat them with your meal? Is that easy for you to do, or is it easier for you to go to the local fast food establishment and get some type of meal for $5 and that you could make yourself full by that? And so we've got to think about what we're providing in our minority communities to help them be healthy and what they have access to. So it's not only about food and what they choose to eat or what they have access to eat, but then it's also about healthy living. So do they have sidewalks that they can walk on? Do they feel their sidewalks are safe, their community is safe to walk to? Do they have to take multiple buses just to get to a full service grocery store? Is it faster and easy for them to go to the convenient mart, which is right down the corner from their house, and get whatever they might have, which is probably not a lot of fresh fruits and vegetables, but a lot of processed food that they can eat and serve their family? So yes, there are choices, but often the choices that we make are because what's easy for us and what's accessible. And so moving forward, what I'm working on and what the Center for Public Health Innovation is going to work on with many of our community partners is how can we create the environment in the inner city community that resembles the environment in the suburban communities.
Well, Liza had a question that, Stephanie, you might be able to address. She wants to know what type of collaboration is the City of Columbus, and I imagine that would include also the Urban League, doing with insurance payers to address disparities in healthcare. Is there anything underway? A lot of these people who have lost their jobs have lost their health insurance. Is anything being done to try to address those problems?
Well, I think it goes back to, again, most of the folks in the urban community are not insured, period, unless they have Medicaid or Medicare. So you're talking about a different kind of environment. I think Dr. Roberts would share this issue. We don't, a lot of us in the urban communities don't have a primary care physician. And so when you have, messaging out there about see your primary care physician, that doesn't equate to me because I don't have a primary care physician. I go to an emergency room. That's where I go. And so when you start looking at these health disparities, this is one of those bigger issues that, yes, we're going to have to start dealing with. But for us, the first thing is, let's look at the financial institutions. How can they help as people are getting those, and I don't mean to switch the subject on Liz, but how do we look at those those payday lenders and those folks who are going to be taking those checks that are coming in and then taking a large percentage off the top, and then folks, don't or cannot finish paying their bills. We want to be able to help people figure out how do they get their do credit repair, so that they can then go to the banks and that then they can get credit cards or get loans. We want to look at helping people get their credit score up so they can look at home ownership. So this really is about financial literacy and economic empowerment. Then we can start looking at, talking to health insurance companies, because if I can get a job where there's health insurance, then we can have a different conversation. But right now, that's not a conversation that we can really have.
And people who are getting the checks through the mail, the $1,200 checks, can they take it to an institution like the local Huntington Bank? It's certainly a guaranteed check. It's coming from the federal government. Or do they have to go to these payday lenders?
Well, I believe that the NAACP and the county were having conversations. I think it was Commissioner John O'Grady. They were having conversations with some of the larger financial institutions to figure out a plan of attack on how those individuals could. But again, we're trying to get people, as people come in to see us, let's see if you are credit worthy, if we need credit repair, and then we'll try to then direct you to one of those institutions where you can get your check cashed.
Okay. Jane Scott, who is the president and CEO of a Metropolitan Club, has been very carefully going through questions that were coming in while we were talking. And so, Jane, what have you got for us?
Yes, question from Jaron Terry from P Flag Columbus. I'm wondering if there are any disparities in instance and outcomes among members of the LGBTQ plus community. Have we seen any stats on this from the coasts or other countries or locally?
That's a great question, and I have not seen any demographic data specifically about the LGBTQ community, nationally or locally.
Okay. Question from Bruce Smith. Of the 14,000 cases diagnosed in Ohio, how many of those are active cases? How many of the 14,000 have recovered from the virus? Of total hospitalizations, how many folks have been discharged? I don't think these stats have been published. And then there's a second question that's relevant or relative to this. Are there folks who have been diagnosed, recovered, and gotten it again?
So great question. In terms of the number of active cases, that's a difficult number to define because everyone recovers differently. So, there are some individuals who get diagnosed with COVID-19 or in the ICU and intubated and don't get discharged from the hospital for 3 to 4 weeks later. And then there are other individuals who are diagnosed with COVID-19 and have a much milder course of disease. And, from the time of diagnosis, 7 days later, they could be back at work and doing fine. So we don't have a criteria to say the number of active cases locally or statewide. We just know the number of individuals we've diagnosed. In terms of individuals who've had a repeat infection, who've been diagnosed, recovered, and then gotten the infection again, I am not aware of any locally here in our jurisdiction, but that's not to say that that couldn't occur. There have been some scientific journals that have written about cases similar to that in other countries, but I'm not aware of any locally here in the Franklin County area.
Okay. This question came to us online from Lori Overmeyer from Gettler Associates. Disasters of any kind always bring out economic and social disparities, and then we as a society seem to move on to the next thing. Do we think this extreme situation may actually bring about a change in the infrastructure of our community so that we see real improvements? I don't know how much worse it has to get before we realize change has to happen.
So I know Stephanie probably has some comments to make. I would say that, from our mayor and what he expressed at his State of the City and his equity agenda, under his leadership, I am confident that we will see change here locally. This is not just, a little blip. This is going to be a way of life for us moving forward and how we handle this pandemic and how we prepare for the next, not only the next wave of COVID-19, but for the next pandemic. And so I'm very optimistic that we are going to see some significant changes here locally and how our city looks at minorities or those who are living on the fringes.
I would agree 100%. The mayor has been strong as it relates to his commitment to dealing with the disparities, knowing that they're going to be exacerbated. I have to, do kudos to the mayor and the city council. They were a part of making sure that we had additional funding for small businesses so that they don't go under. So that was a city and a county endeavor. We have, our public officials have been stepping up, which has been wonderful. The county has been stepping up, making sure that we have those additional dollars to put in place for housing stabilization. And I know that the corporate community has also been extremely generous, the Columbus Foundation as well. But I think what we have to look at is when we look at the disparities here and them being exacerbated, we have to look at culturally competent kinds of services. We can no longer do things the same old way. And that's not to say that there aren't people that are doing the work for people of color, but people of color have different needs. They have a different way to communicate. And so how do we build capacity for those trusted entities in the urban communities so that people can get the help that they need? And as long as I'm sitting in this chair and don't get in trouble, I want to continue to keep this messaging out there because I think it's so vitally important right now.
It leads to a question that I'm looking at that I received ahead of time from someone named, it's either Jaron or Jaron Terry, who said, it seems there is a fine line between, one, uncovering disparities for purpose of ending them, and two, inadvertently disparaging the underserved by exposing them. How can communicators best navigate this tightrope?
Well, again, I think having all of us collaborating, Colleen, it's important to have our leadership, like the mayor, like the county commissioners, who are making these investments in recognize and saying out loud that these disparities exist and not being afraid of it or covering it under the rug. And and when we have more leaders in our community, meaning from the majority community, that are willing to take on these kinds of conversations, and they are critical conversations and they're hard conversations, but it's time because this is an economic piece that will impact all of us long term, not just the urban communities, but the majority communities will be impacted by this as well. So if we leave one person behind, that all of us are eventually going to end up in that same boat.
Michael Holcomb asks, what does expanded capacity to scale up contact tracing look like?
Sure. So in my team, we've already expanded some of our capacity. So just to put it in perspective, prior to COVID-19, I had 7 nurses who did infectious disease investigation. So they were the ones who called a case, and if there was someone that we needed to contact who was exposed to the case, like for meningitis, they did that. So I took that team, they're still doing that, and I've added 43 additional people to that team. That's what we're doing right now. And we're getting anywhere between 30 to 40 new cases a day, give or take. So I can expand more. It might mean I'm going to take people off of other things they were doing. We've scaled down many of our clinics already. So I had an STD clinic that had 6 providers. Now I have 3 providers in the STD clinic because I've moved some of those providers to do case and contact investigation. So could I scale down more in that area or other areas? So I have the capacity right now within my department to do some of that. And if I need more, I would probably look for other city departments to help me before I would move for volunteers.
Jennifer Hodge asks, when is Ohio going to update health education standards to prioritize health literacy?
Well, that's important, and it needs to be done. And I think, again, some of the positives that are going to come out of this pandemic is to know that we do not have in the state of Ohio health education standards that are expected. And so we have some school districts that are providing great health education and others that aren't. And unfortunately, the ones that aren't are usually in the urban communities.
This is a question I'm going to paraphrase a little bit. This is Juliana Nemeth from Ohio State University College of Public Health. How do current testing protocols, where a person must be referred to testing through a primary care provider with hospital admitting privileges, create disparity in healthcare access to for residents of Columbus? And how is Columbus Public Health working to address testing access for Columbus' most vulnerable populations? And I guess my question personally that I would add to that, knowing that a vaccine is a year, 18 months away, it seems purely from looking from the outside in that testing is really the key for us getting back to work and getting back to normal.
Right.
Testing?
Testing. So, that's a great question. And I can say, this week, I think our community's been in a situation where we have some extra capacity to do more testing. And so one of the things I'm looking at is working with the federally qualified health centers, where we know many of our minority population, our uninsured, go to get their health care, and making sure those systems have a mechanism in place to get individuals tested for COVID-19 without going through the healthcare system, or the emergency system, I should say. And so that's what's currently happening. Many of their patients are referred to the ER. And as Stephanie said, many in the minority community don't have a primary care provider. They might have insurance, but they don't have a primary care provider. So when we give them that guidance, it's like, well, what do I do? What we've been telling them to do, and we've been assisting individuals, if you are sick and want to get tested for COVID-19, give us a call at the health department at 645-1519, and we will connect you and get you tested. And we have been able to do that. Our hospital partners have taken those referrals. So we're going to continue to work on that to make sure that access for testing is available to all. And in terms of the vaccine, it could be 18 months. I will assure you that if it's anything like H1N1, Public Health was the one who had the vaccine first, and we provided the vaccine to the community in some of these large arenas. I imagine it's going to be something similar to that. So it'll be accessible to everyone, whether you have a primary care home or a primary care provider or not.
Excellent. So housing evictions, frankly, I was shocked at one of your comments before about the evictions. I just don't get it financially. These landlords know where this is coming from. These are not derelict tenants. These are people that have been pushed over Niagara Falls. What kind of programs can the city put in place to make sure these landlords potentially would defer rent rather than kicking people out on the street? Don't they understand that it would take a lot more money and time to renovate these apartments, and they're going to have them empty for a while because the whole community is dealing with this?
I would agree with you 100%. I will say Councilwoman Shayla Favors has been hosting a weekly call with all of us that are in the housing arena. And so, yes, more conversations with landlords we know needs to go into effect. I say at the Urban League, and again, the county is helping us with eviction prevention. We are able to mediate now that we have extra dollars. I'll be able to hire another staff person. But as of yesterday, we opened up a new program called Home Stabilization. We had over 400 people in the queue right now. Don't have enough money to be able to, we're talking about $200, $300 just to keep that landlord from putting that eviction notice on your door. And so, if we can find more funding to do that, I think to landlords' credits, they will negotiate with us. But we have to have the resources to help to negotiate those with those landlords. And you have to remember, and I'm not defending them, but they also have a mortgage they got to pay too. And so, again, it's one of those very complicated situations, but we have to figure it out together.
Well, we are almost out of time, but this has been a very, at times, deflating conversation. So I will ask each of you to give me an optimistic word as we leave about where we are looking forward. Are you optimistic, Doctor, that we are seeing the light that we can walk toward at the end of the tunnel?
So I'm optimistic that we're going to get there. And I want to remind people, we keep talking about this disease and, what it looks like and what it means. And, you're being forced to stay at home, maybe not go to work. And I always like to remind people of things that you can control. There's not a lot of things we can control right now, but there are some things you can control. You can control your exposure, so where you go, who you expose yourself to, just doing those essential duties. And then when you are out doing those essential duties or functions that that you wear a mask. You can control how frequently you wash your hands. Those are the things that you can control right now, and those things will protect your health as well as the health of those around you.
Colleen, you know what, grateful. All of us who have a roof over our head, who maybe still have our jobs, who, have a little money in the bank, we all should be grateful. And I'm hoping that those people who have the ability to wake up every day and say that they are grateful, that they will look a little bit differently at those individuals who are disproportionately impacted, and that they might want to figure out how to make an investment either through volunteering or some other way. But I think, I'm grateful, and I think most of us are grateful, and just appreciate, again, CMC for having this forum, because to be able to have these conversations is really important for our community.
Thank you both.
Thank you, and I'm very grateful for all of you for being willing to come to us and visit, because I agree. We are very, very committed to fulfilling our mission of connecting people and ideas through community conversation. And obviously, we can't do it with a room full of people, but it doesn't mean that we can't continue the conversation. And we're working very, very hard to make sure that the conversation keeps going, and it's important information for the community, so thank you so much. I do hope you found that today's information was helpful, obviously somewhat gripping and somewhat difficult to listen to, but I think it provides us with some challenges and with some direction that we didn't have before. I wish you were here with us today. Believe me, I wish so much you were in the room, but we do appreciate you viewing, and we hope those of you who don't know the Metropolitan Club will go to our website and become better acquainted. We're grateful for the support for today's forum from the National Church Residences, African American Leadership Academy, the Community Shelter Board, and the Ohio Capital for Corporation for Housing. And our live stream partners, NBC4, NBC4I, WSU Public Media, PNC, the Tommy Daly Foundation, MORPC, the Disparities Media Group, and Ohio State University Wexner Medical Center. Our special thanks to our speakers, Dr. Mysheika Roberts, Stephanie Hightower, and Colleen Marshall. Very much appreciate you ladies being here. Thank you. And again, special thanks to all of you who purchased virtual seats for today's forum. We are truly grateful for your support. Be well, wash your hands, and we look forward to seeing you again.